The reason I'm out here today is to really thank community leaders and community members for coming forward and getting tested, but we need this to continue. I especially want to thank our local community leaders, including individuals like Dr. Doan, who is a medical practitioner, a doctor at Fairfield Hospital and has worked in the region for 20 years, who is getting the message out to his community about the importance of testing, and individuals like Mrs. Jabor, who works with our police as a multicultural community liaison to make sure the messages get out to all of our community leaders to really convey that on the ground to community members. It's really important for us to really deal with any community transmission that we're not aware of. New South Wales, to this point in time, has got the balance right. We're able to go about our business in a safe way whilst controlling the virus, and I want to thank everybody involved in that process. The journey in a pandemic is a long one, and New South Wales has fared the last 6 or 7 weeks as best as we can, but of course it's been an enormous community effort. I want to thank all of our health officials, the police, and today in particular recognise our community leaders, doctors, religious leaders, community and cultural leaders, people who've really supported their communities in breaking some of the concerns or stigma that might be associated with getting testing and coming forward and getting testing and knowing and having confidence in the system. If you're someone who needs to work, please know that if you get tested and you're not asked to stay home and the test result isn't positive, you'll find out very soon. So please know that we're making every effort we can to be as efficient as possible, to encourage people to come forward, and please know that all of us have had tests. In fact, we passed the 2 million milestone overnight in New South Wales. There have been over 2 million tests, and I'm one of them, and I'm sure many of you have been tested as well, and a lot of us will have to get tested multiple times. That is the nature of the pandemic. You might be cleared once, you might go through a period of isolation, but then develop symptoms or be exposed to a venue down the track. It has been a team effort. The results to date have been pleasing, but Dr. Chant, the Minister, and I remain concerned about the level of community transmission still lurking in southwestern and western Sydney. So today is about thanking our community leaders who are making sure that everybody is aware of their opportunity to get tested, aware of how we'll take care of them during the process, and not to feel in any way scared or stigmatised by having to get a test and potentially having to isolate. I'll now ask Dr. Chant to give her daily update, and then I'll ask Dr. Doan to say a few words about the importance of members of the community coming forward to getting tested.
So there were 3 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, bringing the total to 3,799 cases. There were 20,720 tests reported in the 24-hour reporting period, and there have been more than 2 million tests in New South Wales. And can I thank everyone for coming forward for those tests. Of the 3 new cases reported to 8 p.m. last night, 2 cases were acquired in overseas and the people were in hotel quarantine, and 1 case was a close contact of a previous case. The close contact of a previous case was a healthcare worker at Liverpool Hospital. They were in self-isolation for an infectious period because they'd been identified as a contact of a patient. The second security guard who worked at Sydney Harbour Marriott Hotel, who was tested positive, we've indicated a number of venues that security guard attended, potentially in his infectious period. However, further testing has indicated that his level of infectiousness at that time was very, very low, and it's unlikely that we're going to be able to isolate any virus from his samples given that low level of infectiousness. Can I just mention a couple of points to reassure the community that even if you have not got Medicare eligibility, COVID testing is free. So come forward for testing in any of our public clinics, any of our hospitals, or go to our website for those clinics, and treatment for COVID and the tests associated with COVID are free. I would also like to explain our rationale for our areas of increased testing. We have identified on our website LGAs or suburbs where we want increased testing. They are usually associated with where we've had infectious patients that may have been out in the community, and also in times where we've been seeing some ongoing transmission in areas And we want to call forward the community to be particularly vigilant for signs and symptoms and help us identify any further chains of transmission. So they're not all of the suburbs indicated are where we have concerns around community transmission. In reality, they are around our assurance that there is no community transmission. And it's important that we get the community in those areas to come forward for testing. And it takes a while for those suburbs to be taken off the list because we know how stealthy the virus is. It can be transmitting in communities because of its mildness of symptoms. And so often those localities stay on there for 2 or 3 weeks after a person might have presented with infectious in those areas. But we do review those suburbs weekly and we revise them weekly. So just as an explanation for those. Thank you.